Good morning. My name is Erich Hagen. I have been a patient of Dr. Motwani for, can't remember the exact timing, but it's been at least 2 years, a little over 2 years since I had my original exam and PRK on both eyes. I started out with extreme myopia as a young kid. So I went to my first eye exam probably in first grade at about 6 years old. And at that point in time, I was not able to make out the big letter E. So all I knew is that as a kid, even though I loved sports, I had a really hard time because, and I'm not going to give you my age, but it was a long time ago. And back then, the glasses that I wore were literally 1/4 of an inch thick. And so one of my nicknames was Coke bottles. And so, you know, it was just something that I had to deal with. And a lot of the sports that I would get involved with were things like gymnastics or running, where I didn't have to like find a ball in the air. And basically, as a young adult, I'm trying to think of the time period, but this would have been probably around the 1990s, and RK was a up and coming thing, and I had RK done on both eyes. And the strategy back then was to basically do one eye for distance and one eye for close-up reading. And so the one eye that they tried to focus on distance, I believe, was my right eye, but I may not get that right. The fact is that the eye that needed the most correction took what they called the maximum number of cuts that they were willing to take on the surface of the cornea, and I believe it was 22 cuts, both radial and circumferential. And basically, the recovery took a while. It did work. I had pretty good vision for, I would say, 2 or 3 years. And then over time, the vision started to deteriorate. And what they came to find was that the amount of scar tissue that developed post-RK occurred over a period of time and didn't stop. And so it got to a point where even just doing the refraction to buy a new set of corrective lenses, glasses, it was difficult to get proper resolution. And so it at some point became necessary for me to kind of look for the next option. And I think one of the options, and I may not get this correct, but it's, I think, one of the more common procedures where they basically cut a flap on the surface of the cornea. And I can't remember the name of it, but basically that sounded like an option. It was a lot quicker healing time, and I was really motivated to do something. But then my eye doctor at the time, Dr. Bell, who's retired now, suggested that I come down to Cornea Revolution and see Dr. Motwani, that they had a procedure that was a little bit more involved in terms of the amount of time invested, but it basically utilized laser technology to essentially ablate the scar tissue very selectively. Now, my background is engineering, and I could just imagine a laser basically sanding in a precision way scar tissue down to like 60 nanometer resolution. And so I had to do it. And I'm so glad I did, because the result was really an incredible result. I was wearing no glasses for the first time in my whole life and seeing fine. And so I have now been a little over 2 years post PRK, and there is a little bit of distortion still in each of the eyes. I am totally good with where I'm at with a fairly minor correction. And so my strategy after talking to the doctor today is going to be to continue the treatments with Mebo and Xiidra, which are drops that'll help restore a healthy cornea. And I'm going to do that for a total period of a year, so I have 6 more months to go on the drops. And then I'm going to see where I'm at. Today I picked up a prescription for a new pair of glasses because the ones that I picked up 6 months ago no longer work. And you know, basically in 6 months I'll decide if I can just go with this very minor correction with corrective lenses, or if I'm going to take a final tune-up. But anyway, that's all I've got. You know, I would do your own research. I would really have you talk to the folks at Cornea Revolution and see if this is an option for you. Thank you for letting me express my experience with everyone.